Hello, my name is Katie Bird. I am a gynecologist here in Arlington. I currently work in an office with 3 other doctors at the moment, and between the 4 of us, we see quite a wide range of demographics in our female patients that come into the clinic, anywhere from 16-year-olds to even women up in their 70s. But today we're specifically going to be talking about a disease known as PID, which is pelvic inflammatory disease. It's an inflammation of some or even all of the female organs within the pelvic cavity. PID is commonly caused by a bacterial infection that spreads from other organs, and complications from it can include obstruction of the fallopian tube, which is also known as salpingitis, and it can also lead to infertility. If the patient experiences salpingitis, it could also lead to a symptom which is known as hydrosalpinx, which that is when the fluid has been accumulated within the fallopian tube. The most common way to diagnose this is to examine your patient, most commonly with a vaginal speculum. PID is more common than most other diseases that are found in women, as there's approximately about 1 in every 7 females who have experienced it at some point. And the most common way that you can treat this PID is just with antibiotics. So for an example, last week we had a 25-year-old Caucasian female come into our clinic who has experienced some pain in her vagina and lower back, and she said it was unlike her normal menstrual cramping. She expressed that she had had some intercourse with her boyfriend the week prior to her coming in, which the pain had started the day after and then had only progressed worse from there. She otherwise was a really healthy female who had never experienced any major problems before. So we did an examination on her, and it was determined that she had pelvic inflammatory disease that needed to be treated. So we sent her home with just a prescription of some penicillin. She reported back to us this week and said she was doing much better. This is a disease that can be spread through unprotected sex, so if you encounter any patients who have mentioned that, definitely stress the importance of what protected sex does so that this doesn't reoccur or happen to them. It's something that's common in females, but it's highly and easily treatable, so the importance of being safe needs to be of concern to them and to us, so that way we can properly help them prevent this. It's important to let your patients know that also if they claim they're having unprotected sex, that the side effects of this not getting taken care of in time when it occurs to them can be important and serious, considering it has serious issues with their fallopian tubes and can even result in infertility. So as long as we are upfront and let them know that all your sexually active patients are aware of these issues at hand, we can help lead to less cases of reported PID. Thank you.